Hello and welcome. Today we're diving deep into a specific lung condition often linked to systemic lupus erythematosus, or lupus pleuritis. We'll explore what it is, how it develops, and what can be done to manage it. Let's get started. Lupus pleuritis, as the name suggests, is primarily caused by systemic lupus erythematosus. SLE is an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues and organs. While the exact triggers for SLE are still under investigation, genetic predisposition, environmental factors like sunlight and certain infections, and even hormonal influences are thought to play a role. Lupus pleuritis arises when cell-related inflammation targets the pleura, the delicate membranes that line the lungs and the inside of the chest cavity. To understand lupus pleuritis, we need to understand the pleura. Imagine two thin layers, one hugging the lung surface and the other lining the chest wall. Between these layers is a small space filled with lubricating fluid, allowing the lungs to expand and contract smoothly during breathing. In lupus pleuritis, the immune system's attack on the pleura causes inflammation. This inflammation leads to the accumulation of excess fluid in the pleural space, a condition known as pleural effusion. The inflamed pleura also becomes irritated, causing pain, especially during breathing. This inflammation and fluid buildup impede lung function and cause breathing problems. Lupus itself is more common in women than men, and lupus pleuritis follows a similar pattern. It affects individuals of all ages and ethnicities, although certain populations, such as African Americans, Hispanics, and Asians, have a higher prevalence of SLE and consequently, a greater risk of developing lupus pleuritis. While precise global statistics on lupus pleuritis are difficult to gather due to the condition being often reported as part of general SLE manifestations, it is estimated that a significant portion of individuals with SLE will experience pleuritis at some point during their illness. The signs and symptoms of lupus pleuritis can vary in severity. The most common symptom is chest pain, typically described as sharp and stabbing, often worsening with deep breathing or coughing. Shortness of breath is another frequent complaint, resulting from the fluid buildup restricting lung expansion. Other symptoms can include a dry cough, fever, and general fatigue. These symptoms might also be accompanied by other lupus-related manifestations, such as joint pain, skin rashes, and kidney problems, depending on the individual and their overall SLE involvement. Diagnosing lupus pleuritis involves a multi-pronged approach. First, a thorough medical history and physical examination are performed to assess the patient's symptoms and overall health. Imaging studies, such as chest X-rays or CT scans, are crucial to visualize the pleural effusion and identify any other lung abnormalities. A pleural fluid analysis, obtained via a procedure called thoracentesis, helps determine the cause of the effusion. This involves extracting fluid from the pleural space with a needle for laboratory examination. Blood tests are also performed to check for markers of lupus activity, such as antinuclear antibodies, SNA, and other AU antibodies. Ruling out other potential causes of pleural effusion, like infections or heart failure, is also essential. Lupus pleuritis doesn't distinct classifications beyond its association with SLE. The severity and extent of pleural involvement can vary from mild to severe. What's most important is identifying and managing the underlying SLE to control the inflammatory process affecting the pleura. Treatment for lupus pleuritis primarily focuses on controlling the underlying SLE and managing the pleural inflammation and effusion. Corticosteroids, such as prednisone, are often prescribed to reduce inflammation. Immunosuppressant medications, like methotrexate or azathioprine, might be used to suppress the overactive immune system in more severe cases or if corticosteroids alone are not sufficient. Pain relievers can help manage chest pain. If the pleural effusion is large and causing significant breathing difficulties, a thoracentesis can be performed to drain the fluid. In rare cases, more invasive procedures like pleuritis may be necessary to prevent recurrent fluid buildup. Since lupus pleuritis is a manifestation of SLE, preventing its development directly is not possible. However, managing SLE effectively is key. This includes avoiding triggers like excessive sun exposure, managing stress, and adhering to prescribed medications. Regular check-ups with a rheumatologist are vital for monitoring disease activity and making timely adjustments to the treatment plan. The prognosis for lupus pleuritis depends largely on the severity and control of the underlying SLE. With appropriate treatment, most individuals experience significant improvement in their symptoms. However, lupus pleuritis can recur if SLE is not adequately managed. Recent research focuses on developing more targeted therapies for SLE that can specifically address the inflammatory pathways involved in lung disease. This includes exploring the role of biologics and other novel immunosuppressant agents. Researchers are also investigating biomarkers that can predict the development and progression of lupus pleuritis. allowing for earlier intervention and improved outcomes. That concludes our exploration of lupus pleuritis. Thank you for watching.